Okay, this is my audience. Say hi.
Hi.
There you go. Okay.
So my name's Taylor Morgan, and I'm doing my speech on diabetes and how to manage and take care of it. Okay, so how many of you guys like needles or like getting shots?
Nope.
No. So what if you had to do that every day, at least like 6 times a day?
It would be terrible.
That's what diabetics have to do. There are approximately 7.5 million diabetics in the U.S. alone, and worldwide there are 346 million.
Wow.
So most likely in your lifetime you will know a diabetic if you don't already. So first I'll ask, do you guys know what diabetes is?
Kind of.
Sort of.
Kind of.
A diabetic is their body can't produce the insulin it needs for their body to function properly, so they have to inject themselves with insulin, which our bodies will naturally produce anyways. So there are the 2 types of diabetes I'm going to focus on are type 1, juvenile diabetes, and type 2, which is adult onset. So I will inform you about the critical procedures that diabetics take to maintain their health. So let's get started. So type 1 diabetes is incurable and it's unavoidable. Juveniles get diabetes type 1 when they are younger kids, and they have to grow up with it for their whole life. There's no cure for it. They can treat their symptoms in 2 ways. They can either have a pump where a needle about this big is constantly in like their stomach somewhere, or they can put it up on their chest, and then they hang their pump either on their pocket or somewhere on their clothing, and it will constantly be reading their blood sugar levels. And or they don't want to wear a pump, they can inject themselves with insulin multiple times a day whenever their blood sugar is high, and they just have a needle and they just inject it somewhere in their body. So the other type of diabetes is type 2, and this one is completely avoidable and it can be cured. The most common people that get this are if they're over the age of 45, if they're obese, and if they have high cholesterol or high blood pressure. So the ways to treat it is keeping a healthy diet and keeping your blood sugars and your cholesterol normal. And with their bodies, they do produce insulin, but it doesn't produce it correctly, so they'll still need to inject themselves with insulin and all this stuff. So in order to cure it, you have to keep a healthy diet and you have to exercise constantly. So now that we know what we're dealing with, we can know how to best avoid the complications. So the steps that diabetics must take to avoid their complications, the first thing they have to do is they have to be able to commit to being able to take care of their diabetes, because if they don't commit to it, then they're going to have complications constantly. Secondly, they have to have better dental care than anybody else, because when you're diabetic, you're more prone to gum infections, so you have to constantly floss and brush at least 3 times a day. You have to be able to keep your blood pressure and your cholesterol normal, which I've already said. And this is weird, but you have to constantly watch your feet, because when you have high blood sugar, you can cause nerve damage in your feet, and cuts and sores the blood won't really clot right, and you could get infections and you could end up losing your feet. So also you have to keep up with your vaccinations more than most people would. You have to constantly get all of them to help fight these infections that you will most likely get. You can't smoke when you're a diabetic, because you're more likely to get some sort of heart disease rather than a person that doesn't have diabetes and smoke. You have a lot bigger chance. You have to get your yearly physicals just like anybody else, but you have to make sure that they're every single year. They recommend that you would take aspirins, because they work as a blood thinner, so your blood won't clot constantly, and they recommend that you take those daily. When you're drinking alcohol, you have to be able to drink it very responsibly, because alcohol, when you're drunk, it masks the symptoms of having low blood sugar. So you have to test it at least once an hour when you are drinking alcohol. And you have to pay very close attention to stress, because when a diabetic is stressful, their blood sugar will drop a ton. And you, again, like, stress will also mask the symptoms of having low blood sugar, and you really don't, like, you won't know when it's low, and you'll end up having to go to the doctor or the hospital. Okay, so we've discussed the two different most common type of diabetes, and we have talked about the actions that diabetics must take in order to have a healthy, normal lifestyle. I hope I've given you a better understanding of how diabetics take care of themselves, and how just these little things that we do every day is very critical for a diabetic.
A+.
There you go.